Welcome to the RADECT Health Podcast. Today we have Shelly Paulson, a physical therapist and yoga instructor. She has worked with elite athletes and mental health patients and everything in between. Her journey in physical therapy has taught her much about how we can improve physical therapy and make it more accessible. We think of preventing readmission of hospitalizations, but what about pain? She has thought about this issue, and she's thought about, as a physical therapist, what can we actually prevent instead of waiting till a lot of problems become acute? Because once you do have the pain, it can be very, very challenging in your life. She is a diehard Minnesota wrestling and Vikings fan, so we can also root for the Vikings and the Packers in our company, RADECT. I'd like to introduce Shelly and have her give a quick overview of herself, and would like her to describe a little bit about how she got into becoming a physical therapist and in your work, Shelly, as working with elite athletes and in mental health patients.
Health and wellness, rehab. I was a multi-sport athlete in high school and decided I wanted to be an athletic trainer, and went to the University of Minnesota with that thought process, and started out volunteering with the Gophers football team actually, and realized that I didn't love athletes. Not that I didn't love football, but it's just a little bit different take on the world of rehab than I was looking for. They're hardcore. Athletes are highly motivated, almost to their own detriment, and coaches are motivated to get them back on the field. So I kind of realized that it would be hard for me wanting to promote health, wellness, focus on rehab in the athlete world. So then I turned a little bit towards physical therapy. And that's kind of where I spent the rest of my time. I volunteered in a lot of places to make sure it was the right fit for me. So I was in outpatient therapy. I did some pediatrics. I did a multiple sclerosis clinic, which I loved. And then I went to inpatient and I did some acute care in a burn center, a lot of chronic pain issues there, and settled into some TCU right after I graduated. And there was post-op, a lot of hips, knees, shoulders, all good things. Every PT should have to do some post-rehab or post-surgical protocols to get them started. It's a great basis. And from there, I moved into home care and aquatic therapy for chronic pain, and settled 12 years ago into the realm of mental health. And I've been there ever since. So working in a mental health facility as a physical therapist has given me a whole new perspective on what it means, what wellness means, and how we should be promoting that as healthcare workers. And it's also was able to let me tie in my chronic pain background, because in mental health, there's a lot of chronic pain. And so I was able to use my experience there. And that is kind of where I have stayed as a physical therapist.
You've been active as a physical therapist for many years.
Yep, a lot of different areas.
So you also became a yoga instructor. And so what does it mean to do both yoga and physical therapy, and why they connect?
Yeah, so I was a yoga student way before I was a yoga teacher. I found yoga because of an injury I had myself. I was injured while running. I love to run. I love to run races, and I was training for marathons at the time and had some just nagging injuries, nothing huge, but just enough to kind of keep me out of the races at the time. And PTs are notorious for being horrible patients ourselves. So I was doing all the things that trying to rehab myself, and it just wasn't working. Like I said, we're terrible patients. I was probably pushing myself too hard. I was focusing on strength and, getting back out there. Like I said, athletes are terrible, terrible patients. And I had a friend who suggested I try yoga, and it was very different for me. I was being instructed in this restorative poses, and really slowed me down a lot and made me take a step back and just kind of look at my body from a different perspective. I really, really enjoyed it and I got better. And then I dove a little bit more into the whole area of yoga. You know, a lot of people think of yoga as the asana part, just the physical work, but there's so much more to it. And as I learned more about breath work and meditation and relaxation and the things that went along with the yoga philosophy, I realized that that is what was making me feel better. And that was also making me perform better once I get back out to running. Just a whole different perspective. And I wanted to learn more. And so that was why 4 years ago, I took the yoga teacher training. And as I was doing that, I was slowly incorporating all of those concepts into my current patients in the facility that I'm working in. And I noticed that they were getting better too. And not only did they get better, but I was able to reach out to more people than just the rehab patients. I could start some groups, and we actually started a chronic pain program in our facility because of my experience within the yoga world. And we have a wellness committee that I also started. So we have a wellness group where we look at health from the whole person perspective, but we're tying it into their physical symptoms, their mental health symptoms, and it's just been great. So tying the two together has been amazing. So using the yoga concepts in the physical therapy world has been great, but it also led me to realize that prevention is so important. And I think we overlook that a lot in our current healthcare system. And so I'm trying to incorporate that into the patients that I see as well.
So the patients you see, it's interesting in that it's not a traditional physical therapy environment. You can't actually touch the patients. They're a unique group. And so how have you learned how to work with these types of patients in that type of setting where physical therapy is very much historically being on a bed or being on some type of platform where you can actually touch the patient and feel the muscles and have a sense of what's going on. And now you really have to do it from a distance. What has that been like, and what is it like having to create this? Because it really didn't exist. It's not like there's a manual or a book how to do this.
No, that is exactly right. I was learning so much. And you're right. Physical therapy is normally a very hands-on profession. And I do see value in that. I believe in the value of healing touch. I do believe there is something to that. I will even recommend to some of my patients, after they're discharged, maybe go get a massage because you need to work on this. But in the mental health world, our patients, a lot of them have a history of trauma. Or a history of aggression and everything in between. And so we take a hands-off approach because you don't want to upset anything more than we need to. So I have learned a lot about assessment. And so basically, I have learned that you can learn so much about a patient by what they're telling you, their subjective info. So if I'm asking, and we always ask those questions, but now I'm really listening because I really need to know. So when do you have your pain? What motions are you doing? What does your day look like? When does your pain start? What exactly are you doing? Can you get dressed without pain? Are you laying on your right side or your left side? So I'm listening to what they tell me and I'm using that information. And then at the same time, I'm watching them. So I can be 10 feet away from the patient, watching them on their bed or on the treatment table and looking more at facial expressions. And, as they're telling me how they feel, I'm looking now, are they able to do that? Does their arm look like it hurts when they bring it up? It's amazing what you can learn just by listening to your patient and then also looking at their movement patterns. So you can gather a lot from their posture, and then you can give verbal cues. I've gotten really good at giving verbal cues to get patients to do the motions that I want them to do. And I try to tell them or show them, even with demonstration, how it should look and then have them correct that. And I think there's actually a lot to that. I mean, there is some value in the tactile cues, but being able to verbalize it and have the patient incorporate that and do their own cues internally and then try to figure it out, they learn a lot from that. So I've been able to gather information that way, but then also teach that way. instructions for exercise. So demonstration is great, following somebody else do an exercise and then listening to verbal cues, all of those things I've been able to do. And then on the flip side of that, for treatments, once we get the assessment component done, I kind of get a feel for what is causing them pain, what activities, what motions, where they're limited. I mean, you can see range of motion from across the room if they can lift their hand, their arm up or not. Or you can say, can you put your jacket on? And then you're watching them and it's the same thing. You're getting the same range of motion, but it's a functional pattern. So that's kind of cool, to be able to use those cues and get the information that way. But then for treatment wise, once I've gathered all that information, I can see that there's restriction there and just general range of motion or exercise may not cut it. Well, then I'll give them cues on things. That's where I dig into my yoga background and I, think of some restorative poses where we can work on that range of motion in a really relaxing, comforting environment, some long, prolonged stretching. And I'll, show them some of those techniques and I can have them do restorative yoga poses to improve their range of motion. And then also if I feel like they need soft tissue work, but we're not doing hands-on massage, I'll use things like, okay, take a racquetball or here's a tennis ball and I'm going to have you put it, right in the area that's painful and I'm going to have you lean back against the wall and have them do their own soft tissue mobilization. Or take a foam roller and lay on the foam roller for prolonged traction or using that as deep tissue and tension relief. And the benefit to doing that is they don't get used to, if you go to traditional PT, you see your PT for 5 or 6 times. They go in, they do the treatments, you go home, you're better while you're seeing them. And then when you stop going to therapy, your symptoms come back and you don't have the knowledge to treat yourself. Well, this way, they're doing it themselves from the get-go. So if I'm trying to instruct them into stretching a muscle, I'm not stretching it for them. I'm teaching them exactly how to do it. So they've had that information from day one. So I think that really helps in the patient's, the longer lasting effects and then less reoccurrence. So I think there's benefits that I have found. It's been challenging, but I've also found that there's a lot of things that are really beneficial. So
one of the things RADECT is working on is trying to bring a team-based environment. So you're kind of unique in that we're working with yoga instructors and we're trying to bring in physical therapy, but you're both. And one of the things we're really looking to do is kind of fuse those so that we can train the yoga instructors how to help people, and how to assess people on a periphery way, so that in at least in a sense of if we could provide some more preventative PT, because we can use these yoga poses. However, if someone does have lower back pain, some of those poses are not good for you, and you have to assess what the back pain actually is. How is that? Yep. How do you, and now when you fuse those two worlds together, how do you do that?
So I think, we've got some great yoga ambassadors too who are really knowledgeable, and then they are able to look at a patient or a member and see, okay, this is what we're trying with them. This makes sense for them. If something isn't going right, I think that's when they can pull us in and be like, okay, we need some suggestions. Just like we've, been doing, we can help them be the eyes for us and, which movement patterns are they showing. I think we're going to be able to work with them really well because we do have that background. We know what to look for, depending on what the lower back pain is and what poses give them pain, then we can direct them into which exercises and which track to go on from there. So I think we'll be able to work together really well in that. And that goes for the preventative side as well. So if they're, not having pain, but they're predisposed to pain, or they have a history of pain, or maybe some of their postural motions that, just the way they're built puts them more at risk for pain, and a yoga ambassador wants to bring us in and help guide that way, we can do that too, because there's a lot of back pain that's caused just by a predisposition to it based on how you're built. And so we can be brought in that way and kind of guide them and show them the right exercises and what to avoid. I think that's going to be really helpful.
Cool. Well, now one of the other things I want to bring us back to is preventative physical therapy, because there's this feeling that people have developed chronic pain. They'll develop sciatica. 25% of the U.S. people have pain, and there's just so much. If it's arthritis or if it's something that can cause pain or inflammation, that the PT is involved with, but usually it has to be worse enough that someone like you, Shelly, has to get involved. So what are the things you see that can be prevented and that are very frustrating if you had that ability to see people earlier than when they're coming in and kind of have this chronic pain and a lot of inflammation or other issues?
Yeah, I think a lot of that is going back to the way the software in RADECT will identify some things that people are doing on a daily basis that maybe isn't the best thing for them. I think we can identify that earlier. For instance, a lot of problems today come from workplace ergonomics. We see people all the time with chronic neck and back pain, and it is so preventable. There's so many things that you can do on a daily basis, just those small little habits that can prevent neck and back pain. And you may not even know it. It may just be from a very small thing, such as the position that your desk is, or the position that your laptop keyboard is causing carpal tunnel. All these little things, ties into preventative. And I think if we can identify, where some of that pain starts, what part of your day, we can pinpoint it to that. So I think that's going to be a huge benefit. And then just looking at a person's posture, just like I said, the way they're built, and starting with a program that improves posture and their day-to-day habits is going to change that drastically. And going back to that team-based approach, we can look at things from a whole team perspective, because it's not only preventative, physical therapy as far as, okay, these are the stretches you need to do if you're starting to have neck pain on a daily basis or starting to have back pain on a daily basis. But we can look at the whole person and say, okay, what does your intake look? Pull in our dietitian and be like, okay, maybe it's the not enough water. Maybe you're not eating the right foods. We can incorporate that whole team approach before things get to that point. And I think having us all on board is going to identify things a lot earlier. People who have had a previous injury is a really big thing for us, and a big red flag as a PT. Kind of when you see that history of what their injuries are, or even a family history of what they could possibly have coming down the road and what they should probably look for. And so we can guide our exercise programs that way as well, which is very important. So if somebody, had an ankle injury or a hip or knee injury, and now they're starting to have some, foot pain, we can look and say, okay, well, that's possibly related. And perhaps maybe they had, this surgery that's causing this pain now. And so we can, start them right down the track on a right program for them that can help prevent that. So I think we'll have a lot of people on board that can identify things, and that can be our way of developing a program geared towards the individual. I think it's going to be great.
So now I want to take you back to the other subject of professional athletes, because you've also worked with them in the past. And you say they're very stubborn, or they can be stubborn.
It happens.
I'm joking around a little bit by saying they're stubborn.
Not really,
because you have worked with a lot of athletes. So we joke. I've talked with Shelly, and we joke around a little bit about that. But what are the things, you see a lot of professional athletes, they're going to have a lot of joint issues, but they're also going to have, you see them come up with a lot of, small tissue issues and also hamstring. What are the things is there things that could be preventative that could help these athletes that keep them from having these issues, both now and later in life? Or is it just something that just the sports that they play, it's just something that's hard to prevent based on the wear and tear on their bodies, you see?
I think it is a little bit of both. I mean, high-level athletes push themselves, and the sports I've worked with have been Olympic sports, more the wrestling and gymnastics, and then I also did yoga class with the cross-country team at the high school. And I think it was one of the best things that we ever did. And this was before I was even a yoga instructor. It was when I was doing restorative yoga through PT. So I was doing more a PT approach. But for runners, it was one of the best things they could do to prevent injuries. And then I started thinking, how about we incorporate it? Like, what if we got every football player, doing a yoga program before they worked out? How many injuries could we prevent? I think the problem is athletes get tied to their sport a lot. And what I mean by that is they train, and you need to train how you play, right? You need to train for your own sport. But I think we could utilize a lot more cross training and really work on preventative stuff versus training specifically for their sport. So if you have an endurance athlete, they spend way more time doing endurance things than they do strengthening and flexibility. But I think if we could break that down a little bit and really focus on the individual athlete and what they need to perform their sport, I think we would be serving them a lot better. I think every athlete should be focusing on prevention, and also that is a whole team approach too. So that is bringing in a dietitian, what is right for them, and interesting, the sports that I work the most with, wrestling and gymnastics. It's a little bit different than if you're a power lifter who needs to put on the pounds, and you're a wrestler who needs to take the weight off, or you're a gymnast who needs to be the appropriate weight for all the twisting and flipping and throwing your body through the air. It's very hard when you're dealing with athletes, and you need to take them on an individual basis. So I feel like if we can use a team approach with athletes, they're going to benefit a lot more from that too. Kind of looking at everything they're doing on a daily basis. They need to be getting a lot of sleep. They need to be taking in a lot of water. They need to have, the right amount of protein to energize their day. So there's a lot of different sides to being an athlete that I think we can look at versus just looking from one perspective. And I love the idea of getting our athletes doing cross training, including restorative yoga poses and yoga program, not just for the physical aspect, but for the relaxation component, the breath work. Every athlete should have breath work. And then the meditation component, just tying that mind-body connection, is great for every athlete. They function at a high level, both physically and also mentally. They have to be on their game all the time. So I think if we could help work with them on that side of it, that would be great too.
So when does PT come in and do this type of work? Is that mainly just for professional athletes, for professional teams, or collegiate athletes and collegiate programs, but there's kind of a gap after these players play, or in the high school level? Or is it actually, have you seen this is something that doesn't happen so much, kind of the PT person comes in if there's an issue?
Yeah, it depends on the level of athlete. There are so many now athletic trainers that are also PTs. So if you are if you're looking at like the NFL teams, all the major leagues, baseball, football, hockey, they have athletic trainers and PTs on staff. The problem occurs when you get more towards the high school level or youth level. And that's kind of where it all starts. Your health, wellness as an athlete starts when you first start the game. So I wish we would recognize that, how important that is to have a PT on board as a youth athlete or a high school athlete, because then we could be adding some preventative PT in at that level. We have athletic trainers on staff. Always, every school, every sport does, to identify once the injury occurs, but we don't do a lot of preventative things at that level. You're more training for your sport, you're time limited if you're a youth athlete or a high school athlete. So that's where I feel like we're kind of lacking. Then we bring the PT in after the injury occurs. Mm-hmm. So unfortunately, that's kind of how our system is set up right now when you're a not lower level, but just younger athlete.
And also, do you see a lot of professional athletes getting this type of help after they finish their career?
I would say not near enough. Now, I don't work with a lot of ex-athletes to know, but, or I should say ex-professional athletes. I've worked with a lot of ex-athletes, and unfortunately, even people that I see now, a lot of their injuries, they'll tell me, came from high school football, and they're 42 years old, and they're dealing with a shoulder injury or a back injury, and they will tell me their original injury came as a high school athlete, which is very interesting to me because it doesn't necessarily mean that their injury was that significant. It probably more likely just means they were not getting treatment at that time. But I see a lot of chronic injuries that stemmed from a prior injury, and that doesn't mean they were a high level athlete. I mean, they could have played through 10th grade and they were a D lineman who hardly got to play, but they still, that was their injury. And now in their head, that's kind of, their pain has gone on for this many years. I mean, that's where, we can definitely work with that athlete and, that person, that former athlete. The tissue heals. So even if they're relating it back, we're looking at chronic pain, which is a whole different animal than an acute injury. So now we need to bring in our chronic pain toolbox and try to get them working in that frame of reference.
Now, because you work in a mental health, you work with mental health patients, you have a unique environment for a variety of reasons, as we've touched upon. But one reason is you get to work with therapists and a team. What are the types of things you see as important in working with a team as a PT and working with these types of people and trying to help them? And where do you see that team-based approach can improve, and where do you see that it really shines?
Yep, because we are a mental health facility, we do work, the team that we do have usually brings in a psychologist or psychiatrist, primary medical, so your typical medical nurse practitioner, or we have medical doctors as well, physical therapists, we have occupational therapists and rec therapists, because they recognize the physical aspect is as important as mental. So I do think we do take a lot of that into account. It's hard differentiating somatic pain in this case from an actual injury pain versus the mental pain and depression side. But I think where we lack in our facility, at least, is we don't look a lot at, we're missing the diet component. A lot of times we are missing the social aspect because a lot of them are isolated in their lives outside of our facility and they're not connecting as well in our facility. So we try, but it's pretty hard. It's hard to connect all of those. So I think that's one thing that we are missing. We do a really good job of listening with the medical side and the psychiatric side and trying to come up with how can we best serve this person. But there's definitely room for improvement, but it's a hard area to work in.
Mm-hmm. I can imagine. And it's always been a challenge with social determinants of health, because you might be doing 80% of the work, but that last 20% might have a major impact. And those are falling through the cracks. And then you have a system that's supposed to help these people, and it might do 80% or some percentage, but without the completeness, it becomes very, very challenging to effectuate change. That's what I've heard from a lot of social workers in the past, and they always feel like it's like if it's not one thing, it's another thing, and sometimes they can see improvement in something, but then they're not seeing overall improvement, and they're not quite sure why or what's the reason, and then they start to get some understanding, but there are time limitations to work with people. It makes things very difficult. So it sounds like it sounds like an interesting journey. Now, the last question I wanted to ask you is, a lot of people, they develop things like sciatica, or they develop the types of pain that you probably traditional PTs see all the time. What are some of the ways that people can start to identify and say, hey, this is something that maybe some markers or something that could let them know something isn't so right, and I should get some help, because we really don't do preventative work in PT very much. It does exist. You can, but people aren't going to pick up the phone and schedule an appointment with a PT, especially through their health insurance, and get their health insurance to pay and say, "Oh, I felt this way, so I'm seeing my PT." They'll say,
Right.
you don't meet the qualifications." So, is there this trajectory and ways to identify some of this, some of the more major issues before they happen, and what should people be looking out for if that's the case?
Yeah, I have to say that is a huge problem. Is a lot of times people do not seek help for minor issues. They just really don't, because for one, like you said, it's not a coverable thing, which is a terrible thing. And another, people's lives are so busy. I mean, I do know, even when I used to work in a traditional outpatient clinic, we would have people canceled just for the fact that they literally can't get off work, or they can't, pick up their kid on time, and life is just so busy. I think making wellness a priority before it gets to that point is so important, and it is very hard to do. But if we can get to that point, so that, red flags are if you're having pain that limits you to do your normal daily things. If you're having pain that prevents you from functional activity that you normally do, getting up, getting dressed, getting to work, working an 8-hour day. And a lot of people don't stop there, right? They have activities at night. They have things that, obligations, they have kids, their night goes on and on. If your pain is limiting any of those activities, it's probably, past time. If we could get people where they're noticing symptoms as soon as they start to affect their functional activity, their function from day to day, before your function changes. So if you have to change your function, I think that's the time to whatever your, resource is. If you if you have a primary doctor, if you are seeking, some sort of holistic option, that is the time to get involved. But people are busy. I think we need to find a way to tie into people's lives versus them having to stop everything, to get to a PT appointment, or go across town because that's the one that's in their provider network. Or, there's so many reasons that people don't follow through with the recommendations for healthcare. But if we can get people on board with a wellness program before it starts, I think that's so important. And there's a lot of different ways we can do that. The world of telehealth is great. I think that's, there's a lot of benefits to that. And then, just providing education on what, like you said, let's say you do have sciatica and it started out kind of as low back pain, and now it's in my hip, and pretty soon before you know it, it's going all the way down the leg. Those are sure signs your symptoms are getting worse. It's time to get in. But if we could, get you in when you're just having low back pain, and we can start, from there, and we can work on work ergonomics, or we can figure out little ways where you can get a 10-minute walk in your day, working with someone in wellness who has that time to look at your whole life, to look at your big picture, and figure out how, we can fit into your life versus you coming and fitting into ours. I wish, we could look at wellness that way, because I think we would do a lot more preventative PT and preventative health if we could do that.
Yeah, it's interesting in the yoga world. People, if they feel they have back pain, they're generally not wanting to go to a yoga instructor, because they like, what am I supposed to do? I'm supposed to do online videos. I'm supposed to go into a class, and I have this pain. And usually that's a red flag of, I have an injury, or I don't feel good enough to speak to a yoga instructor. I think that's where, from our standpoint, through RADECT, we're trying to make a kind of a change there, where the yoga instructor becomes a continuous care to handle whatever people's physical abilities are, instead of trying to limit them to, here's how the studio should work and here's what we need to show them. And I think that's kind of a big step change for these yoga instructors, and the ones we have we're working with as ambassadors. They were excited to hear about this just because, they really like all the other aspects of helping people. Then, I ask the question to yoga instructors, and I ever say, how does it feel when you have issues with a client which limit things, and you're supposed to say, well, these are my boundaries, this is what I can do. And I said, and then I told them, well, we want the opposite. We want you to actually have the capabilities to work with these people based on that. And for them, that was kind of an eye-opener, being very different, but that's not the way. Everything's been very siloed, and also within the healthcare system, everything's very siloed. For you working in an actual facility, you were able to interact with a number of people, but more typically than not, even within a hospital, doctors don't interact with each other unless it's a big enough issue, something they don't know. It's not like a really true team-based approach where everybody's sharing knowledge and figuring out how to improve a process. So I'm really happy we were able to have you on, Shelly. Be able to learn a little bit more as a physical therapist, because connecting physical therapists and yoga instructors would seem like a dilemma, but we're kind of changing ways that we're thinking about things. So I really appreciate having you, and thanks so much.
Yes, thank you. It's been great.
Okay.